Hi, today we're going to talk about egg freezing. This is a procedure where we do in conjunction with the IVF, in vitro fertilization. This enables women to become pregnant at a later date. They undergo treatment to retrieve the eggs and we can store the eggs for future use. As you know, as the woman gets older and older, the number of eggs tend to reduce and they attain menopause. But the uterus still can remain functional. The eggs can be stored and frozen for an indefinite time. With attention, when they choose to get pregnant, we can thaw, which is to defrost the eggs, and fertilize it with their partner's sperms, and they can achieve a pregnancy in the future. The procedure's success rate depends on the woman's age. The younger they are, the higher it is. There are a few indications for, or rather reasons why this procedure can be done. The first is if the woman has been affected by cancer, for which she has undergone chemotherapy or even radiotherapy, where during these procedures, the eggs will be destroyed. So, preserving their eggs, they still preserve their future fertility. Secondly, those patients, for religious reasons, they do not want to freeze their embryos. Example, if you were to do an IVF and you get 15 eggs, for example, we'll inseminate all the eggs, and resulting in probably about 8 babies, where we can transfer 2 and the rest we can freeze them. But certain women do not want their embryos to be frozen, hence we just inseminate, the number of eggs are required and the rest we freeze them for a future use. The third reason is for career women who want to climb the corporate ladder, do not want to start a family at the earlier part of their career. Hence, they can undergo this procedure and retrieve their eggs and store them till when they are ready. The method of doing this is that on the second day of the menstrual cycle, we'll start injections for about 10 days. And in between, we'll scan the woman 2 or 3 times to ascertain whether the eggs have increased in size or rather matured. Once the eggs have reached about 17 mm and above, then we will retrieve the eggs. We'll put them under anesthesia or even sedation, do a transvaginal scan. With that, we have a very fine needle to aspirate all the eggs one by one. At the same time, the embryologist, they will examine the eggs to ensure the eggs are fit enough for freezing. The process of freezing is called vitrification, where we can freeze the eggs without forming ice crystals. Ice crystals can be detrimental to the eggs. This is done by using cryoprotectants, where they replace the water in the cells and prevent the formation of ice crystals. When the woman is ready, then we will thaw the eggs out and let it grow in the lab. We will get husband's or her male partner's sperms and inject it directly in the egg to ensure fertilization has taken place. Then 5 days later, we got a blastocyst. That's when we transfer the embryo into her womb to get her pregnancy. A lot of people are worried that will there be birth defects or will there be abnormalities in these babies? No. There are a few recent studies that have proven that the number of abnormalities, chromosome abnormalities, are similar in the natural conception. So, if you're keen to delay childbirth, I would recommend that you freeze your eggs for future use. It's just like making a fixed deposit. If you'd like to know about it, please contact us and we will explain more in detail. Thank you.